Hi, I'm Dr. Mejia with Jupiter Dermatology and Hair Restoration, and today we're talking about Botox treatments. And Botox is a very common treatment to help lines of facial expression. And the most common areas of facial expressions are on the forehead, in the glabella, between the eyebrows, and around the face here. And I'm going to ask Blanca to go ahead and raise your eyebrows, and you can see all the movement here that you can see. And many men and women actually like to reduce these lines and wrinkles. Here, big smile for me. And all the lines around here, we can soften the lines of facial expression by injecting Botox in here and also in the glabella if she makes a mean face or a squint. You know, a lot of people don't like these 11s that you see here. What Botox does is it gets absorbed into the muscles and it prevents the release of a substance called acetylcholine, which prevents the muscles from moving. Okay? And that's how Botox has been used. And Botox is a very safe product. It's been used in the market for over probably 15 years now with very little to no complications from a medical standpoint. Botox does carry some risks of injections. There's always a risk of a little bleeding, a little bruising, a little swelling. In some cases, if the patient manipulates here, and we tell them not to manipulate or rub the area, that can cause spread of the Botox beyond where it's injected, and in some cases, some patients can get, a little eyelid, drooping. Okay, but to avoid these complications, you want to go with an experienced injector that knows the anatomy of the face and knows how to inject Botox. And what we're going to do is actually demonstrate this technique here and now. Okay, one of the important things to make sure is that you get all the makeup off and cleanse the area well with alcohol. You can see that there is some makeup on, so we do like to make sure that the area is well cleaned, because when you are injecting Botox, basically if you're going through makeup or any dirty substance on the skin, you could potentially inject that into the skin and cause a contamination. So it is important, number one, if you're going to get Botox, try not to put a lot of makeup on, but make sure that they clean you very well before the treatment. Botox comes in is a purified protein. It comes in a little vial like this, and to make sure you're getting the right Botox, it does have a hologram on it here, which you can see to make sure that it is an official Botox and not a knockoff product or a fraudulent one or fake. But it comes in this vial, and it is diluted with saline, and the amount of dilution will determine how many units you're getting per vial or per syringe. Okay, typically in our practice, we speak in terms of number of units that we give to patients because it's per unit charge. So if you get a lot of units, you pay for a lot of units. If you get a little bit, you just pay a little bit. Many people do it by syringe and by areas, and if you're really not sure how many units you're getting or how it's being diluted, you could be paying $20, $25 a unit and getting just a small diluted amount. So it's important to know the number of units that you're getting per area. So what we're going to do now is go ahead and inject the Botox. And in many cases, we do provide a little topical anesthetic. In this case, she's decided to just go au naturel. In many cases, it's not that bad, even without any anesthesia. But for some patients, we do provide some topical anesthesia here to let it sit there for a few minutes and let it provide some topical numbing, and it does help lessen the sting. So we're going to treat the glabella first, and we're going to do a little injection right here into the we call the procerus muscle. A little pinch. Just going to inject a little bit of Botox there. Sometimes you can get a little pinpoint bleeding. Give me a face. Relax. Relax. A little pinch. Just inject a little bit more Botox there. Turn this one a little bit here so we can see.
It doesn't really hurt at all.
Okay. Little pinch here to make a mean face. And you can see how the muscle's moving. And I want to go right into that muscle right there. And everything is customized for the patient in terms of how much is being injected and where and what type of results they're looking for. And as you can see there's some tiny little bumps or swellings that will go down in time. We do tell patients not to try to massage this area because it can spread beyond the area, and you don't want that to happen. So now we're going to do the forehead. Okay, so put your chin down just a bit. So raise your eyebrows. Okay, you can see all the lines that run across there. So we're going to do a little bit here. Raise your eyebrows again. A little pinch. Okay, we're going to do a little bit of Botox here to spread it out. And all she needs is just right here for her, some little small injections right there on her forehead, and that will diffuse and spread and hit all these areas that are affecting her here. And the last area we're going to do is around the eyes. Around the eyes, we always warn patients that there can be some bruising, only because there are a lot of blood vessels under here, so we try to avoid them as much as possible. Okay, but it always is a risk, and patients need to be aware of that. Big smile, little pinch, relax. Okay, a little bit here. Give her a little eyebrow elevation right here. Okay, that helps with that. Okay, great. Now we're going to go to the other side. Treat the other side here. Okay. Smile. Okay, relax. So we're going to treat the glabella first. So we're going to do a little injection right here into what we call the procerus muscle. A little pinch. Just going to inject a little bit of Botox there. Sometimes you can get a little pinpoint bleeding. Give me a face. Relax. Relax. A little pinch. Inject a little bit more Botox there. Turn this way a little bit here so we can see.
It doesn't really hurt at all.
Okay. Little pinch here. Make a mean face. And you can see how the muscle's moving. And I want to go right into that muscle right there. And everything is customized for the patient in terms of how much is being injected and where and what type of results they're looking for. And as you can see there's some tiny little bumps or swellings that will go down in time. We do tell patients not to try to massage this area because it can spread beyond the area and you don't want that to happen. So now we're going to do the forehead. Okay, so put your chin down just a bit. So raise your eyebrows. Okay, you can see all the lines that run across there. So we're going to do a little bit here. Raise your eyebrows again. A little pinch. Okay. We're going to do a little bit of Botox here to spread it out. And all she needs is just right here for her, some little small injections right there on her forehead, and that will diffuse and spread and hit all these areas that are affecting her here. And the last area we're going to do is around the eyes. Around the eyes, we always warn patients that there can be some bruising, only because there are a lot of blood vessels under here, so we try to avoid them as much as possible. Okay, but it always is a risk, and patients need to be aware of that. Big smile, little pinch, relax. Okay, a little bit here. Give her a little eyebrow elevation right here. Okay, that helps with that. Okay, great. Now we're going to go to the other side. We'll treat the other side here. Okay. Smile. Okay, relax. Okay, a little bit here. And the last big smile again. Relax. Right there.
So how many units did you add?
Right now we did a total of about 40 units of Botox, which is kind of a good average number for many people. We hold a little ice there. Just put that little ice there for me.
40?
Yes. Some people need 40, some people need 50, some people can get away with just 20. So it really depends on what we're doing with each individual and trying to customize the procedure for them. So, a little ice does help, okay, just to kind of cool the area, decrease a little bit of swelling. If it gets too cold, we just tell them take it off. But now we're done, and that's basically it. Okay. Now Botox can last about up to 3 months on average. We do have a little cream here that kind of just helps with some of the bruising, so we put this little cream on there just to help minimize any bruising that one might have. Okay, and as you can see here, she hasn't really bruised any. Okay, so she's done very, very well with the treatment. And she's done well even with no anesthesia. So we put that on for a little bruising just to keep any bruising down, and she doesn't have any. And as I was saying, Botox can last up to about 3 months on average is what we typically say Botox and or Dysport lasts. You know, some people do less, some people can do more. And it also depends on the amount of units that are injected. The more that is injected in one area, the longer lasting result you're going to have and the better result you're going to have. That's why I said it's important to make sure that when you're going to places that are charging per unit or per area, that you know how many units. Because one area can only be injected 10 units or it could be 30 units. So it is really important to make sure that you are comparing apples to apples.
So here you did 4 areas?
Here we did 3 areas. So here we did 40 units on average, okay, which is a fairly good number. In many cases we could do 60 units, we could do 50 units, you know, and some people, there are people that do 100 units. But on average, a fairly good amount of Botox, which will give you good results without breaking the bank, so to speak, is about 40 units for all 3 areas, and we kind of spread it out. Some people might need more, and it just really depends on how active their muscles are and how they respond to the Botox.
There's nothing else I need to do, just move it around, or?
Yeah, as far as post-operatively, we tell patients to, you know, activate the muscles, use them, make facial expressions, try not to lay down for the first couple of hours, and definitely don't massage areas because that could spread the Botox to other areas where we don't want it to spread. And just basically let it be and let it absorb into the muscles and the nerve endings to prevent the muscles from moving.
Okay, thank you.
Mm-hmm. Now, when can you see the results of Botox? You can see the results of Botox typically in about a week or so. There's another product very similar, you know, called Dysport or Dysport, and that one tends to activate a lot quicker within a couple days. So in many patients, I kind of feel that they're both fairly equivalent products. But if a patient says, look, I got a wedding or an event and I want it to look, you know, great in 2 or 3 days, then I'm more likely to use the Dysport as opposed to the Botox. But on average, they both last about 3 months or so. And some studies have recently shown that, you know, the more frequent use of Botox does actually help the skin. Some of the clinical studies have shown that histologically they've seen an improvement in change in the texture and the tone of the skin. People sometimes ask, what is the difference between Dysport and Botox? You know, I see prices being advertised, Dysport is a lot cheaper than Botox. And that's not necessarily the case. Dysport per unit is cheaper, but you need almost 2.5 to 3 times the amount to get the same equivalent result. So for a person like Blanca, who say, for example, had 40 units of Botox, the equivalent dosage in terms of Dysport would be about 100 units of Dysport. So really, although the price per unit is cheaper, when you double or triple the amount of units necessary to get the same result, it really ends up being about the same.